Provincial Health Officer. This is the COVID-19 briefing for British Columbia for Tuesday, August the 4th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Wednesday, we'll be providing a written briefing at around 3 o'clock. On Thursday at 3, we'll be providing another in-person briefing, Dr. Henry and I, this time in Vancouver. And then on Friday, there'll be another written briefing. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So today we are reporting on 4 periods over the since last Friday. So that's Friday to Saturday, and we had 43 new cases. From Saturday to Sunday, there were 29 new cases. Sunday to Monday, 46 cases. And Monday to today, another 28 cases who tested positive or were epidemiologically linked. So that leaves us 146 new cases since Friday, 4 of whom were epi-linked, the rest who tested positive for COVID-19, bringing our total in British Columbia to 3,787 cases. That includes 1,119 people in Vancouver Coastal Health, 1,989 in the Fraser Health Region, 146 people on Vancouver Island Health, 377 people in Interior Health, 91 people in the Northern Health Region, and 65 people who reside outside of Canada. We currently have 319 active cases in the province in all health authorities, of whom 8 are hospitalized, 4 of whom are in critical care ICU. In the last 4 days since Friday, we have had no new deaths from COVID-19. Our total remains at 195 people who have died from COVID-19 in BC. Additionally, there are 3,273 people who have now recovered from COVID. We have 1 new healthcare outbreak in the Fraser Valley region at the Maple Ridge Seniors Village Assisted Living Facility, where there's a single staff case at the moment, but Fraser Health is on site and the outbreak protocols are being implemented. The outbreak at Mission Memorial Hospital has now been declared over. So we now have 3 active outbreaks in our healthcare system, all of them right now in long-term care or assisted living. And that includes 660 cases, 404 residents, and 262 staff. We continue to have active outbreaks in a number of exposure events in the community, but particularly at the Fraser Valley Packers, that is now up to 74 cases that are linked to that exposure event. Before I get into the rest of my remarks today, I would like to take a moment to recognize a very special colleague and friend for a very special achievement. Yesterday, our Lieutenant Governor, Janet Austin, announced this year's recipients of the Order of BC. And I am absolutely thrilled that my colleague and friend and mentor, Dr. Mel Crashdon, was one of the 13 well-deserving recipients. Dr. Crashdon, you've heard us talk about him many times, has been on the front lines of our COVID-19 response and has been on the front lines of a number of public health responses over his many storied career. He was instrumental in developing one of the first tests for COVID-19 in the country and continues to work tirelessly on behalf of all of us in BC. And congratulations, Mel, from all of us. We're so proud of you. So as you can tell, there have been a number of new cases over the long weekend. This was not unexpected. We knew that events that had happened in the previous couple of weeks would lead to more people who had been exposed developing illness. We are now seeing people who were exposed up to 2 weeks ago. This is a concern because the majority are related to what happened prior to this long weekend. The source of these cases is varied, and as we've talked about many times, this is something that we take very seriously in public health, and to track down and trace how every single case became infected is important to us. Many continue to be related to private gatherings or small parties that happened over the last month. Many are with travel within BC and Canada, and some are people who have traveled here from outside of Canada. We also have had a number of exposures in workplaces where people have passed it amongst work colleagues. In all of these cases, the common factors are really the same. It's about the things that we're doing when we're in close contact with people. And that includes talking, laughing, joking around, sharing drinks, sharing food. Crowds, so larger combinations of people where we're having those close interactions with many people over a period of time. Often indoors. And the indoor settings we know are areas that are more at risk for us to be transmitting this virus to others. We need to make sure these cases don't result in a dramatic uptick once again. So anybody who has been exposed over this past few weeks now knows, and many of you are in isolation right now and need to be monitoring carefully for symptoms. It is always a concern for me and everyone in public health when COVID-19 spreads unchecked and the source of the transmission is unknown. Thankfully, most of our cases, the vast majority of them, we are able to find out where you've been exposed. And we know that many of those are overlapping social circles where private parties over the period of the last few weeks have led to people passing it to their friends and their family. In the immediate days following a long weekend are when people can also unknowingly spread the virus to others. So for the next coming days, we need to remember what it was that we were doing over these last few days. And the next 2 weeks is important for all of us. Coming out of this BC day-long weekend, we all need to pay attention to how we are feeling. We cannot go to work if we're not feeling well. Contact 811 should you develop any symptoms. We also need to pay attention to where these exposure events have been made. And if need be, we need to immediately limit our time with others. If we were at one of the events where an exposure happened, where somebody was identified with COVID-19, and you may know that in the next couple of days, you need to limit your time with others and take precaution to protect your family, your friends, our communities. The alerts, as we know, are posted on the BC CDC website and on all of the health authority websites. These provide details on where potential exposure occurred and what actions you need to take. Public health will be contacting people directly for those who we know were at events, but sometimes we don't have that information. And that means it's important that you are all aware of where you were and who you may have been in contact with. And that information you will be provided is whether you need to immediately self-isolate for the period of time after the exposure event, or simply to monitor for symptoms if it was a less risky exposure. When there has been an exposure in a workplace, many businesses are also notifying their customers and in many cases temporarily closing to make sure that they have additional cleaning. And we encourage businesses to keep doing this. This is a way to build confidence in all of us that we know where COVID is and we know what to do and how to manage it. When public health teams or business issues an alert, it shows us that our monitoring and our public health response is working because we have identified the source of transmission and know who may be exposed. We know and we have learned that this virus can and has appeared in communities in settings across BC, from private parties to workplaces to healthcare, long-term care, travel. It doesn't discriminate, and nor can we. We must all be alert. We must all be ready to be tested if we need to, and to stay home and away from others if we're ill. We know that COVID-19 is going to be in our communities for some time to come, and we need to continue to do what we know will help to minimize the cases that we have and manage those when they arrive. While it remains in BC, we need to keep it low and slow. When we spend time with friends, when we visit another community on our summer holidays, or take a flight to see our family, the actions we take make a difference to our COVID-19 pandemic curve. We all know what we need to do to keep each other safe and healthy. So let's make sure each day for the rest of this summer, we all play safe and stay safe, and continue to take those necessary precautions that we know will protect everyone in BC. And let's also continue to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry. And obviously, every time over a 4-day period when no one has passed away from COVID-19 is in itself good news to start with, and positive news, although we think of all of the families of the 195 people who have passed away from COVID-19 since the beginning of the pandemic. We think of them now and how difficult this period continues to be for them. As Dr. Henry noted, 8 hospitalizations in British Columbia, of which 5 are in Fraser Health and 1 in Interior Health and 2 in Vancouver Coastal Health, 4 people in critical care, indicates that those numbers continue in single digits to be relatively low, and certainly low in terms of the period of the pandemic. They peaked, of course, at 149 in early April and 149 people in hospital and 72 people in critical care at that time. I think the numbers in the last couple of weeks tell the story that Dr. Henry just told, which is that we've had significant events that occurred in the Interior Health Authority, some around Kelowna, in the Northern Health Authority. But now, in terms of active cases, we've had a significant weekend where there have been most of those cases, 90% of those cases, have been in the Metro Vancouver Health Authorities of Fraser Health and Vancouver Coastal Health, such that of our active cases, 195 are in Fraser Health and 78 are in Vancouver Coastal Health. I note that the healthcare system, we spoke of surgeries last week and another week of returning to above normal July numbers. We also had yesterday 6,324 emergency room visits, which is similar to numbers prior to the COVID-19 pandemic. So people are returning to the healthcare system, and I want to congratulate everybody in healthcare for the work they're doing in dealing with all of these situations. I wanted to, as I do every Monday or Tuesday when we have briefings, I want to provide a weekly update on PPE. As with previous weeks, I'll report how much PPE has arrived cumulatively since March, and then specifically what has arrived over the last week. To recap our cumulative totals from March to last week's report on Monday, July 27th, the following PPE has arrived in BC. Just over 6 million N95 or equivalent respirators, of which 331,000 or 5% are from the federal government's bulk procurement. Just over 29 million surgical or procedure masks, almost 2,400,000 pieces of eye protection, including goggles and face shields, over 65 million pairs of gloves, and just over 4,700,000 gowns. Many of the items I've listed are in the testing process to make sure product meets or exceeds safety requirements before being used in BC's healthcare system. Today I can tell you that over the past week, since my update on Monday, July 27th, we've received the following: 40,754 N95 or equivalent respirators, 7,058,250 surgical or procedure masks, that's 7,058,250, 5,180 pieces of eye protection, 9,667,900 pairs of gloves, and 51,310 gowns. We'll continue to source and test our PPE and are working hard to pursue any and all credible leads for safe and effective products for our healthcare system. That is going to be important this fall and for the year to come. In closing, we said going into the long weekend that we had a job to do to stop the spread. And from most accounts this weekend across the province, that's exactly what we did. We made the BC Day long weekend safe and fun and one to remember for all the right reasons. But as we know, the past month has been a more difficult month for us in terms of cases in particular. And we've seen that in many jurisdictions close to us and familiar to us. We've seen the same thing. Most of those jurisdictions would look at our numbers with envy, but we've focused on what happens here in British Columbia. And having the cases we've had, the 146, about 36 to 37 a day over the last 4 days, is more than we had in June, and about 36 or 37 more than we're comfortable with. As the head of the World Health Organization said yesterday, for individuals, it's about keeping physical distance, wearing a mask, cleaning hands regularly, and coughing safely away from others. As he said, you need to do it all. And here in British Columbia, we know that, and more. We know that physical distancing saves lives. We know that wearing a mask when physical distancing isn't possible saves lives. We know that washing our hands for 20 seconds with soap and water saves lives. We know that coughing into our sleeve saves lives. We know that staying home when we're sick saves lives. We know that staying 100% all in our duty to stop the spread saves lives. And we also know that going to private parties at this time is not something we should consider doing. It's something, in fact, if you're being invited to a private party and you don't know who's there and you don't know the guest list and you don't know the numbers, is something I strongly urge you not to attend. If you regularly host a private party on a particular day of a year, whether it's a birthday or other kind of celebration or even around the resumption of sports seasons, this is the time to keep numbers small. And that is the way we do it, because we know there's no vaccine and we know there's no cure, and we know that we must continue to do it all in response to COVID-19 in BC. And we know that we can. The number of new cases reported today is a reminder that COVID-19 continues to be all around us. We know that we must continue to use our COVID sense and the skills we've been taught to keep us safe, as well as all those who are counting on us to keep them safe too. We know this. There are many weeks left in our BC summer. For us to make them memorable for all the right reasons, we need to renew our effort to stop the spread, no matter where we are in BC. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 4 périodes de référence de 24 heures chacune, soit celle de 31 juillet au 1er août, celle du 1er août au 2 août, celle de 2 et 3 août, et celle de 3 et 4 août en mi-journée. Nous sommes reconnaissants qu'il n'y a eu aucun nouveau décès lié au COVID-19 pendant le week-end. Nous continuons à offrir nos condoléances aux familles et aux amis des 195 personnes décédées du COVID-19 et tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pour la première période de référence, nous avons eu 43 nouveaux cas. Pour la deuxième période de référence, nous avons eu 29 nouveaux cas. Pour la troisième période de référence, nous avons eu 46 nouveaux cas. Au cours des dernières 24 heures, 28 nouveaux cas se sont ajoutés. Cela représente 146 nouveaux cas depuis notre dernière mise à jour vendredi, pour un total de 3 787 cas en Colombie-Britannique. Parmi l'ensemble des cas confirmés de COVID-19, 8 personnes sont actuellement hospitalisées, dont 4 en soins intensifs. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone line, please press *1 to enter the queue. You are limited to one question and one follow-up only. Please also take your phones off mute. You will not be audible until I call your name. First question is from Keith Baldry, Global News.
Hi, Dr. Henry. Thanks for taking my question. Last week you were asked about the wearing of masks on transit, and you seemed to indicate you thought that was a good idea for TransLink to get more proactive in getting people to wear masks on board buses and SkyTrain. I'm just wondering if you've received any response from TransLink since then.
I have. There have been ongoing discussions. I know TransLink is looking at their programs and how they can make sure that their safety plans are enhanced and the best that they can be. So yes, I'm very confident that they are looking at this in some detail.
Do you have a follow-up, Keith?
Yeah, and so do I infer from that you expect in the weeks ahead we're going to see new regulations or new rules from TransLink requiring people to wear masks?
I don't know that the absolute decision has been made yet, but I certainly would encourage it. I think that's an important business thing to do, both at TransLink and BC Transit.
Next question is from Mary Griffin, CHEK News.
Oh, hi. Thanks so much, Dr. Henry and Minister. I just have a question about this online petition that's circulating with close to 15,000 signatures so far against the mandatory return to school. Is there any measure at all or any number of concerned parents that would maybe result in a walk back of some of the measures that are happening on the first day of school?
So I think we need to think about this. You know, the school, as always, has options, and there are many different types of schooling that parents can enroll their kids, and those options will be available this year as well. So this is a plan, and I think this speaks to people's anxieties, and we all have anxieties. We are learning as we go with this virus, but we also know that there are important things that children can only get from being in classroom settings, whether that's full-time all the time or whether it's some variety. So we are working towards that. Parents groups, teachers, administrators, the school districts, and my office, we have all been working together for these plans. And they are in some detail, and those details will come out on a school-by-school basis in the near future, as you know. But currently, we have a framework that we are confident means will keep people safe, will minimize the contacts with a larger group, but allow those important interactions that young people need, absolutely need. And we need to remember as well that there are downsides about children, and there are many children who are experiencing those now. And we've learned that from the surveys that we've done. We've learned that from talking to young people across the province, whether it's increased anxiety, mental health issues. For some children, home is not a safe place to be. Many of them have not been in a classroom for, it'll be up to 175 days. And the type of learning that many children need in that classroom setting is something that we need to make a priority. And look at all of the parents, all of our teachers. We need to work together to ensure that we are giving our children what they need come this school year. And that's what we intend to do.
Do you have a follow-up, Mary?
I do. Thanks so much, Lindsay. I was just going to ask, because Alberta and I believe Ontario have introduced mandatory policies for masks, is that anything that you can foresee in BC's future? Thank you.
We absolutely do see masks in certain aspects of school being important, particularly where adults are together and where children can't maintain those safe distances. So that's all part of it. But no, we have no intention for making mandatory masks, and I actually don't believe there's evidence to support mask wearing by children in the classroom setting.
Next question is from Matt Vatinko, CKPG. Matt, are you there? Okay, moving on to Chris Agal, Haida Gwaii Observer.
Hi, Dr. Henry. What are the total number of confirmed cases on Haida Gwaii as of today, as well as the number that are active or have recovered? And have any required hospitalization to date?
Yeah, so we're up to, I believe it's 24 cases in Haida Gwaii right now. I don't have the active numbers in front of me at the moment. I believe there were 12 active cases now, but I'll get you those details. And there are a couple dozen people who are still being monitored in isolation because of exposures. There have been no hospitalizations to date, and I think that's very good news. And Northern Health is working with all of the communities on Haida Gwaii to ensure that people have what they need to be able to safely isolate, whether because they're ill or because they're in the incubation period right now.
Carissa, do you have a follow-up question?
No, thank you.
Thank you. Next question is from David Molko, CTV.
Dr. Henry, I just want to circle back to the school point and point taken on your confidence in a framework and how some children and children obviously have a lot to gain from being in person when they're learning. What do you tell parents, though, who don't have that comfort level? What do you say to those who are downright fearful, even if the case counts stay low? How do you sort of kind of get through and convey that anxiety is valid, but also try and, explain your confidence in this when they don't have it?
Yeah, this is a common phenomenon that we all experience when we're going through something new, and particularly when it's something that affects our children and our families. So we need to take it slowly. We need to build the confidence that we have. We know that we continue to have low levels of transmission, and that is one of the most important things, and it's something that all of us need to pay attention to, because safety in our schools, safety in our workplaces, safety across the province relies on us having those low levels of transmission in the community, as low as we possibly can, and that protects all of us. So we will be talking more about this as we get closer to the school season and as we get closer to understanding what it will look like for each individual child. But yes, we need to keep talking about it. I mean, we're all anxious. I was very anxious when we started doing surgeries again, when we let visitors into long-term care. But we need to live with those anxieties. We need to talk through them. We need to remind ourselves what we know. And that's the things that we are doing all the time, is making sure that we're keeping up on what's going on around the world and that we're putting in place the best that we can. We need to make sure, and school is such an important environment for our children, and it's something that we need to find a way to make happen in a way that supports them. We know that some children will fall behind and will never catch up, and this will affect them for the rest of their lives. It is that important for us to be able to have school, manage school, despite having a pandemic. And we've done this before, and we can get through this, and we will be working together to make sure that we have the things that are needed in place.
Do you have a follow-up question, David?
I do. I just want to talk about daily case numbers. I mean, I think over the last 2 or 3 weeks when we look at them, it's everything from maybe 19 new positive tests to something like 51 a day, but mostly in the 20s, 30s, and 40s. What numbers, I mean, bearing in mind we need to be realistic about what numbers we'd see, what numbers would you like to see in our daily case numbers? What would be realistic? What would sort of give you the confidence to say, hey, BC, we're back on top of it again?
Well, I actually don't, I think we're still on top of it, and just maybe a little bit higher up on the, but of course zero is the number that I've been looking for a long time. But reality, as you say, particularly with what's happening all around us, we've been seeing what's happening in Alberta. I think the Yukon is there with us. We have our little bubble, but we watch what's happened in the US. We know that this virus can spread very easily if we're not careful, and we've seen that. But we've also seen that where we've identified those scenarios, those opportunities where this virus spreads a lot, and we tell people about them, and we tell you what we can do to stop those transmissions. And for the most part, people are doing that. So the next important thing is for us to be cautious, to be self-aware, but also to be aware of our workplace, be aware of our social settings, and if we have had exposures, to reduce our opportunities to be with others. And the numbers that I'm more concerned about are those cases that are popping up from nowhere that we don't know where they've been linked to. And that's the work that my colleagues across the province in public health are doing. And for the most part, we are able to find everybody in a very short period of time. But we do that because our numbers are relatively low. And that's what we need everybody to pay attention to. We need to all collectively commit to keep doing what we're doing, to maintain those physical distances, to wear masks on transit, to wear masks in places where we can't always consistently maintain those distances. And more importantly than ever, if you've been exposed to somebody, if your friend or a family member or a co-worker has COVID-19, reduce your contacts, monitor yourself for symptoms, and if public health tells you that you're a close contact and you need to stay home, then that's an order. You must do that, and that's what will keep all of us safe.
Next question is from Zara Premji, CBC.
Hi there, thanks for taking our questions. So on the topic of contact tracing from flights, today Dr. Tam said getting enough information from a plane manifest does continue to be a problem. So can you explain exactly what is missing from these flight manifests, and is this an issue mostly for domestic or international flights?
It's both, and it's been something that we have known of for a long time. And it would shock you to see what we get from the airlines when we request a flight manifest. So they, of course, obtain information for booking purposes and for understanding, exactly what price that seat, and they can tell you what price, how much anybody paid for that specific seat. So the information is being collected for a different purpose. And when we need that information to find out who's around, all they know is it's somebody who paid $66 for that seat. So we get information that may be related to who booked the ticket. So if you're booking on points, it may be whoever owns the points, that name will be on it. We very rarely get accurate information about contacts, even where people live. So it makes it a challenge to know if we need to provide information to somebody in another province, or if that person's out of country, where they're staying when they are here. So it really is a disconnect in the system, and this is something that we've made recommendations to Transport Canada and to our federal counterparts. You know, during this COVID time, we need to be able to find people quickly. Introductions from other provinces, but also from other countries into Canada, are one of the things that put us at risk. And so we need to have a system that allows us to identify people rapidly. Or we need to have a system that everybody, like they're doing in China right now, spends 2 weeks in a quarantine hotel after you arrive. I don't think that that's as far as we need to go right now. We'll see. But at least to be able to have contact information, a name, an address, a phone number, where they stay or where they're living, that would be incredibly helpful in allowing us to do this efficiently. We do now, we were trying to contact trace early on in March and April, every single person who came in, because we knew it was introductions that were coming. And it took days sometimes for us to be able to get information that was usable. And when we moved to everybody being required to quarantine and everybody else just not traveling, we suspended that. We're now at the point where we need to find everybody again. So a really important thing would be able to get information, accurate information, that we can contact people quickly.
Do you have a follow-up question, Zara?
Yes, please. So Air Canada did tell CBC it provides all information necessary for contact tracing, and it's done within 24 hours. So specifically, it said the BC government has not requested a flight manifest since March and only recently started asking for seat numbers. So they say they tried to reach out and address concerns that continue to be raised by the BC government, but haven't had a response. What's your response to that? And could we also get an answer in French, please?
Well, I can tell you that they may think they provide information, but I can show you the sheets that we get. And yes, as I said, we stopped requesting flight manifests, and the BC Centre for Disease Control does this on a coordinated basis on behalf of my office. We have requested flight manifests, and even in March when we were trying to get them, it took days to get them. Also, you had to connect with different information, so it does not provide the information we need to find people quickly, and that's an ongoing thing. It's not just Air Canada, it's every airline. It's something that's a challenge around the world.
Just to say in English that this is an issue, getting better access to more complete information that we need to get to work on and change. As you'll know, this area of jurisdiction is in federal responsibility, and it's our hope, and we're working with the federal government on this, and that's why sometimes I guess Air Canada may feel that they're not in touch with us sufficiently. This is a federal area of jurisdiction, but it would be very helpful to have information that we can use to adequately contact trace. And the people who do the contact tracing are saying the information is inadequate. So people can judge whether whose position is more important. I think it's the people that do the contact tracing. We know that we're going to be dealing with this pandemic quite a significant distance into the future. So this would be an important time to make that change, and I'm sure everyone involved wants to do that. En français, je dirais que Air Canada et toutes les compagnies aériennes, c'est pas seulement Air Canada, donnent de renseignements, mais depuis mars, on n'a pas utilisé beaucoup ces renseignements parce que c'est très difficile d'utiliser ces renseignements et de trouver des gens avec assez de vitesse. Et ça, c'est un problème fondamental. Donc, on a parlé, et je pense que le docteur Dama en a parlé aujourd'hui, on a parlé au gouvernement fédéral pour qu'on puisse améliorer cette situation et on a beaucoup de confiance qu'on serait en mesure de le faire de toute façon. On va faire avec COVID-19 pour des mois à venir, peut-être des années à venir. Et donc, il faut se mettre au travail dès aujourd'hui pour améliorer cette situation pour tout le monde, pour la santé économique des compagnies aériennes, je dirais, mais aussi pour tous les gens qui utilisaient ces services.
Next question is from Andrea Wu, Globe and Mail.
Hi, Dr. Henry. There's a petition circulating among residents of Hyder, Alaska and Stewart, BC, calling for the opening of their border for strict locals-only integration. They say this would be a unique situation as the area is so remote. There are no currently confirmed active COVID-19 cases in either location, and it's necessary because residents of Hyder rely heavily on services and amenities in Stewart. Is this kind of bubble something that BC would ever consider?
Yeah, well, I read about that as well. I think it sounds like a reasonable thing. We had a very similar thing with Yukon and communities in northern BC. However, this is not a BC issue, unfortunately, or fortunately. This is a Canadian Border Services, it's a federal jurisdiction because it is between it is the federal border, or the border with Alaska. I mean, I think it sounds like a reasonable plan. My only concern, of course, is that we've started to see dramatic increases in cases in the last month in Alaska, and I know that that's been a challenge for my counterpart, who I talk to regularly from Alaska. Hopefully both of those communities will remain unscathed, but this is something that needs to be taken up with the federal government.
Andrea, do you have a follow-up?
Nope, I'm okay. Thank you.
Thank you. Next question is from Richard Zussman, Global News.
Henry, one of the things you mentioned in your opening remarks was the long weekends and how it seems to put pressure on the system. The BC Teachers Federation has called for the start of school to be pushed back in part because it comes directly after a long weekend. Is the pushback of the start of school something you support? And can you explain, whether you would have concerns with kids going back to school on a Tuesday right after the last long weekend of the summer?
Yeah, I think we just need to set a date and plan for it. And it's traditional that we go back after the Labor Day long weekend, so it is a different tone to that weekend than what we see in July 1st and what we see in the BC Day weekend. So I think, we just need to make the plans and plan towards that and make sure that we're doing what we need to do so it's safe for children on that Tuesday.
Do you have a follow-up, Richard?
I do. I asked this last week, but not clearly, so I'll try again. What thought is being given to before and after school care? And are you concerned about the bubble system breaking down if kids go to before and after school care programs outside of their school pods?
Yeah, so I think the concept of the pods and bubbles are slightly different. So the learning groups are not the same as our family group where we hug and we have that close contact. It does maintain physical distance, but it means you're not being exposed to everybody in the school potentially. You're being only potentially exposed for those periods of time where you can't maintain distance to a much smaller group of people. So again, aftercare and pre-care each family needs to look at how that looks for them. It's a very challenging one. I know I think during this pandemic year, we need to really consider about some of the after-school activities that children may want to be into and look at how we can do those on a much smaller scale than before. Things like we won't be having tournaments where kids come and play sports or big music festivals, things like that people might be involved in after-school curricular, after-school activities as well. So I don't I have not looked at the details of all of those things yet, but I know that the committees that are working on putting these plans together will be considering those issues as well. And parents will have to look at how do we maintain those important supports for our children. And if we're going back to work, and those the balance that we need to have. So it's not an easy answer. We don't have all the details yet, but those are the things that we'll work out.
We have time for one more question. For any reporters that didn't get to ask a question, there will be a statement released this afternoon for recommendations on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca. And for non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. Last question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry. I hate to belabor this point, but regarding schools and the 5 months that British Columbians have been asked to keep their distance, but outside, not inside, wear a mask if you can't keep your distance, and now that we're being asked to do the opposite at schools, have large groups in enclosed spaces with limited distance for long durations of time, the pushback is, what are you asking of students and teachers that doesn't mesh with what we've been doing for 5 months? People do not understand how being close for long periods without barriers is okay in schools, but not at work, not at going out to eat, not at the store, not at a funeral, not at a wedding.
So I think you're perhaps not reading the same thing I'm reading, in that we've not said that. What we're saying is that the maximum that children may be exposed to, but we are continuing to have physical distancing, making sure, especially for the younger children, what we did in June, where you avoid physical contact, where you ensure that you have distancing between desks, that you do it in a way that children aren't mixing and mingling like we did before, reducing the number of people in the schools. So it is the same as at workplaces. It's the same concepts that we are having in every other part of our society that we've opened up, where we maintain distance as much as possible, where we limit the contacts that we have in that setting. But we need to make sure that schools are a priority setting, and we need to be able to give children the instructions, the class, the type of teaching that they need in those settings as well. So it is finding that balance of making sure we're doing everything we can to reduce the risk, knowing that this virus is going to be with us, and we need to find a way to live with it and still have those absolutely critical learning opportunities for children.
Do you have a follow-up, Marcella?
Yes, Lindsay, thanks. Regarding the school cohorts idea, why not just keep classes of 20 together instead of up to 60 or 120 groupings? Is it not better to keep 20 kids learning and mental health seen as mental health benefits for children? Why are we being told the risk of sending kids to school is an acceptable risk now?
Yeah, so I think you need to understand that it's going to be different depending on the classes. And so we're setting a maximum number that would be in a bubble. So that allows, especially for the older students, we know that there's opportunities for different types of classes that different students will need. So to be able to offer at least some variation, you have the potential that people might be in certain classes, but there's ways of reducing that risk. So it is a balancing of finding how to do that right, and to be able to give children what they need, as well as being able to do contact tracing if we need to in those settings. And this will look different. For many children, it will be far less than 60 would be the numbers of people that they'll actually be in a class with or be in a school setting with. But what we're saying is you're not going to have the opportunities for exposure to the 300 kids that are in your school. We're going to be segregating by different ways in different schools. So whether it's all the grade 3s maybe, or broken into different groups. So that's why I can't be specific. There's 60 school districts, and each of them have to look at the ways that they can do it with the students and the numbers that they have. But we've set a maximum level of these learning groups.
And just to say, Marcella, I think we've talked about a lot of different things here about as we've gone from phase 1 to phase 2 to phase 3. We've talked about professional sports teams, and we've talked about drive-in theaters, we've talked about restaurants and bars. We've even talked about adult entertainment. And we've also achieved some things. We've relaunched surgery in a way that's safe. I think we're doing visits in long-term care in a way that's safe. And we've done all of these things in the same way that we're acting here with respect to K-12 education, which is methodically and seriously setting up guidelines put in place by public health professionals who have a record of understanding and leadership in these questions. And so I think we're going to achieve this. And there is nothing more important for us to achieve than having children go to school. It's more important than many of the other things that I've listed. And I think that we have to, I believe that school districts and parents and teachers and communities with the advice and the guidance and the support and sometimes the rules set out by public health are going to be able to get this done, and that we need to get this done, and it's important to us. It's important to us as communities. There are consequences, health and otherwise, for the fact that there are children in BC, and many of them, tens of thousands, if not hundreds of thousands of them, who haven't been in a classroom since spring break started on March 20th. And we have to take those steps because we care for those children, because we want to see them learn, and we want to see them learn safely. So this is the work that's being carried out now. The framework has been put in place with the guidance of public health, and the hard work continues. And it has continued almost from March 20th on, how we were going to do this safely. Prior to June, when we had our partial relaunch of public education, which about 200,000 children took part in, there were anxieties and concerns as well. And listen, we feel those anxieties and those concerns. But I think this is something that's important for us to do together, and something that we take, everyone I think involved takes very seriously, and we're going to work towards achieving in the coming month. And that's my expectation. That's our expectation. That's why these parameters have been put in place, and that's the work we're going to do in the coming period. Thank you very much. Merci beaucoup. À la prochaine fois.